Hi there, my name is David Dalton, Clinical Director of PhysioCare, and I want to talk to you a little bit today about shoulder injuries. I was a swimmer myself and happened to go through a number of these to the point where I ended up with an operation in the end, so I do have first-hand experience. Shoulder joint consists of a ball and socket joint made of the humerus, bone here, and the scapula creating the ball and socket. It's an inherently unstable joint because the ball is too big for the socket. Common injuries that happen in the shoulder would be what's known as a rotator cuff tendonitis or a bursitis. The other common one we'd see here at the clinic would be frozen shoulder. A bursitis of the shoulder is when there's a fluid-filled sac here becomes inflamed. People get an acute onset of severe pain at the tip of the shoulder, usually unable to lie on their side at night, and the pain can be quite debilitating. For a bursitis, the best treatment is relative rest, some local electrotherapy modalities, possibly some anti-inflammatories, and maybe an injection. The other common injury in the shoulder would be a rotator cuff injury. A rotator cuff injury is where one of the four tendons that hold the ball in the socket become inflamed for a variety of reasons. The rotator cuff injury is probably the most common, and that presents as a catching pain as the arm moves through abduction or a pinch at the end of range flexion. It's classically, people can't put their arm on their coat. Again, this catch and twinge with a deep dull ache at night. Treatment for rotator cuff would be along the lines of deep tissue massage to the tendons, soft tissue release to the neck to ensure the position of the scapula is appropriate, shoulder blade positioning, and really important in the longer term, rotator cuff strengthening to make it stronger so your symptoms do not return. In severe cases, you may need to look to injection. The other common problem then would be the frozen shoulders. In the case of frozen shoulder, the patient usually presents with painful limitation of movement in all directions. Frozen shoulder can be incredibly painful at night. Treatments for this include passive mobilization. They inevitably do need anti-inflammatory tablets, may need some manipulation, and in cases then do need injections. If you have any questions on how we may be able to help you with your shoulder problem, please do not hesitate to contact us here at PhysioCare.